Hi, this is Kimberly Diaz, owner of Care Matters Always, Caring Minds Dementia Consulting and Training, and Care Matters Registry. I talked a little bit briefly before about what a consultation with a care navigator looks like, but I also wanted to get a little bit more in depth about some of the services I provide personally. I've been a nurse for over 27 years, and I've been the founder of Care Matters since 2018. Some of the services that I provide and I help families with are hospitals and rehabilitation discharge support. Unfortunately, our case managers in the hospitals and in the rehabs have a lot more stress on them. The system is telling them to flip those beds, get those patients out, get those beds empty so we can get new people in there. And oftentimes, your loved one isn't quite ready, or you're not quite ready to receive them at home. So I can help with some of that coordination. I can go into the hospital or into the rehab. I can talk with the rehab team. I can help put a plan together to make a successful discharge, whether that's going to be to go to an assisted living, a memory care, long-term care, or coming home. Also assessments and reassessments, conducting a comprehensive evaluation to determine the care needs of your loved one. Maybe they're trying to send them to long-term care because that's the place that accepted them with the bed, but maybe they don't need long-term care. Maybe with some rehab and a little bit of support, they can do fine in memory care or assisted living. So I can help with those. I can also help with in-home coordination. So maybe your loved one is ready to come home, but we need some extra support. I work with about 40 different, very well trained, versed, independent contractors who provide caregiving in the home setting. But I can come meet with the family. I can help to determine what level of care is needed. And then have the caregivers come in and they work independently and they can provide that support to you at a rate that feels comfortable to you, the hours that you can choose. So it's really care done your way. Also, community placement. I'm a certified placement specialist. I've been doing that since 2017 here in Colorado. I am certified with COPRA, which is under the National Placement and Registry Association. So we have a certain set of ethics that we follow. Placement is a free service to clients. So I go out, I meet with your loved one, I meet with you, we discuss financial goals, what finances look like, what psychosocial support they need, what physical support they need, what emotional support they need. And then I have contracts with the communities and I am reimbursed by them based on our contracted rate, somewhere between 30 and 60 days after that placement. Again, I do all of this upfront work and there's no out of pocket to you when it comes to placement. End of life guidance. I'm also a death doula. I worked in hospice for 17 years. This is an area that is near and dear to my heart. I feel very comfortable in. So I can help you, make those decisions. Is it time to bring in palliative? Is it time to bring in hospice? What are the benefits of bringing those in? So I can have some of those kind of scary conversations with you ahead of time, help you feel confident. This is also, Medicare covers hospice 100%. They cover any medications that your loved one needs that are associated with their terminal illness, any supplies, briefs, wipes, plus you get an amazing hospice team. You get a nurse, a social worker, a chaplain, a nurse's aide. You get pharmacy, you get a physician, you get volunteers. You also get grief support for up to 13 months after your loved one dies, because you never know. Grief comes and goes and it's going to hit you in waves, and to have that support is so important after you lose a loved one. I'm also a dementia consultant and trainer. I've been working with dementia for the past 17 years as well. And that's also my other place that's near and dear to my heart. Really helping to advocate for get rid of the stigma around dementia, and help with that connection. You know, in dementia, they often lose their words, but they communicate in other ways. They communicate through body language, through sometimes what is labeled as behaviors, which is really an unmet need. So becoming a Sherlock Holmes, becoming an investigator to find out what's really going on with them and how can we help support them to help support you as their caregiver. In situations where the client has no trusted family, I can act as a medical power of attorney. I work with elder law attorneys who will be the fiduciary in some cases. So if you don't have family, or you're estranged from your family, or you don't want your family making decisions for you, I can act as that medical power of attorney. Also, as I mentioned, relocation assistance. We even help people move here from other states, or vice versa, help people move from here to other states. Within the placement world, there's different placement agents in all the different states, so I can help connect you with them. I have caregivers that like to do traveling, so I work with them, and they'll, fly your loved one here potentially, or drive them. There's a lot of different ways to make whatever's on your heart happen. As I mentioned, I have a registry, so in-home caregiving at a rate that's about $10 to $15 less an hour than our competitors. And these are caregivers that are vetted. They have a minimum of 3 years of experience. Most of them have 10 to 30 years of experience. I have a few caregivers in their 20s, but most of our caregivers that I work with are in the 30 to 50 range. I have some that are in the late 60s. These are people who have chosen this as their career. You interview them, they interview you, and if it's a good match, I'm just that matchmaker. That is your caregiver. I also can be a mediator for families in conflict. When these things come up with mom and dad, unfortunately, also a lot of conflict can come in. So I can come in as a neutral party and be that mediator to advocate for your loved one. And then there's also the advocacy services. Once I place a client, I don't just place them in a community and forget about them. If there's ongoing issues that come up, we will sit down with the community. We'll figure out how we're going to make this work. Sometimes I may need to advocate for, something that's going on in the hospital or going on in rehab, or rehab wants to have a meeting with you, but you don't understand all the medical jargon that they're throwing at you. So having someone like me with 27 years of experience to sit at that table with you so I can talk you through what's going on. I can also help kind of coach you beforehand on the questions that you need to ask and what you should be asking and what you should walk away with. So long story short, I have a long list of services. I have a huge heart for seniors and for the adult children and families that are taking care of them. Caregivers need love. Our patients need love. We all need to have some grace for ourselves and more love in our hearts. So if you'd like to work with me, please reach out. I'm located in Westminster, Colorado. That's my parrot you've probably heard a few times in the background. You can reach me at caremattersalways.com or 720-310-0491. Thank you. Bye-bye.